What modern medicine says about enlargement of the spleen, splenomegaly, and scarification. Welcome back to AfroHealthBridge, where we explore African health traditions and examine them through the lens of modern science and public health. In our previous episode, we discussed the traditional Asan healing practice called uvinmi, where abdominal scarification is used to treat a condition known as ude, believed to be a disease of the spleen. Today, we ask an important question. What does modern medicine say about this condition? In clinical medicine, the term splenomegaly simply means enlargement of the spleen. The spleen is an organ located on the left side of the abdomen that helps filter blood, remove damaged blood cells, and support the immune system. However, splenomegaly is not actually a disease by itself. Instead, it is usually a sign that another illness is affecting the body. In many parts of tropical Africa, the most common cause of enlarged spleen is malaria. Repeated malaria infections cause the spleen to work overtime, filtering infected red blood cells. Over time, this constant immune activity can cause the spleen to enlarge significantly. Other medical causes of splenomegaly may include severe infections, liver disease, blood disorders, and certain cancers of the blood or lymphatic system. In modern healthcare settings, doctors diagnose splenomegaly using physical examination, ultrasound scans, and laboratory tests. These methods help determine the exact cause of the enlargement before treatment begins. Now, here is where the difference between traditional belief and modern medicine becomes clear. Abdominal scarification, as practiced traditionally, does not treat the underlying cause of splenomegaly. Instead, it attempts to remove what is believed to be bad blood from the body. However, medical research suggests that this explanation does not align with biological science. A community study conducted in rural Edo State found that many children who received abdominal scarification did not actually have splenomegaly, indicating that the procedure was often performed without accurate diagnosis. Wagbatsoma et al., 2007. In addition, modern medicine warns that making incisions in the abdomen can lead to serious complications such as infection, severe bleeding, and internal injury. There have even been documented cases where scarification led to evisceration, a dangerous condition where internal organs protrude through the abdominal wall. Following deep cuts, Mordi et al., 2018. This does not mean traditional healers intentionally harm patients. Historically, they developed treatments based on observation and cultural understanding, long before modern diagnostics and medical technology became available. But as healthcare knowledge evolves, it becomes important to evaluate traditional practices carefully and ensure they do not cause unintended harm. In our next episode of AfroHealthBridge, we will take this discussion further by examining the public health implications of abdominal scarification. Stay with us as we continue bridging African culture, traditional medicine, and modern health science.